What are some of the most deadliest diseases, and what is it like to die from them? Now, before you immediately scroll on, hear me out. I've been doing this series. You guys seem to like it, where I discuss specific diseases that I see a lot on hospice and what is it like when someone dies from them. Now, why am I talking about this? I'm talking about this because I have found that the more people learn about these types of things, the less they fear them. So here we go. This week we're going to do glioblastomas. This is a type of brain cancer, and brain tumor, actually. I do see this a lot on hospice. It is very difficult. It's usually in a younger population, 20s to 40s. I see a lot of men with this type of cancer. However, women do experience this as well. Remember, I am talking about the population who is on hospice. So you do have a whole nother journey with this diagnosis before you're on hospice. When you come on hospice, you are usually very debilitated. So you have a functional debility, meaning you are usually needing someone to help you with your daily living activities. Your mental capacity could be down as well. You might not be as alert and oriented as you normally are. There is usually a lot of symptoms with this disease, unfortunately. The main ones I see are confusion, agitation, seizures, and pain. I also see a lot of existential crisis with this disease because the person's usually young and usually really fighting not to die. Okay, so how can we actually help as a hospice team? So as a hospice team, we are going to come in and try to utilize all we can to optimize your life. Decrease your symptoms so you can live your life to the best of your ability, to help give support to your family who's trying to take care of you. There are so many things we can do as hospice providers to help manage pain, help manage your seizures, and help manage confusion or agitation. The social worker will also definitely be working with this family to help with all of the emotions that come along with this disease and taking care of somebody with this disease. I will say by the end of this disease, just like any other disease, most people look the same. This is during the actively dying phase. Most people will be fully unconscious, not eating and drinking, changes in breathing, changes in skin color, and terminal secretions. That's not any different with this disease along with any other disease. Most people dying will look like that. I do see terminal agitation a lot with this diagnosis, so sometimes we do have to use palliative sedation to make this person very comfortable while they are dying. Palliative sedation is basically sedating somebody so they're very comfortable until they die. And yes, that is an option on hospice. Let me know if you've experienced this with someone you've loved or any questions you may have regarding glioblastomas. Thanks for listening, guys.